How much coffee is safe during pregnancy? Although the official recommendation is up to 200 milligrams of caffeine, equivalent to a 12-ounce cup of coffee each day, some experts believe that even moderate amounts of caffeine during pregnancy can introduce risks. Previously, studies have linked high caffeine consumption to babies being small for their gestational age, or at risk for intrauterine growth restriction. But researchers at the National Institutes of Health recently found that women who drank less than 200 milligrams of caffeine a day during pregnancy, as little as half a cup of coffee per day, had slightly smaller babies than non-caffeine drinkers. Researchers noted that caffeine is believed to cause blood vessels in the uterus and placenta to constrict, which could reduce the blood supply to the fetus and inhibit growth. They also said that caffeine could potentially disrupt fetal stress hormones, putting infants at risk for rapid weight gain after birth, and for obesity, heart disease, and diabetes later in life. However, other studies have found no link between moderate caffeine consumption in pregnancy and problems such as low birth weight, IUGR, miscarriage, or premature birth. That's why moderate caffeine consumption during pregnancy gets the okay from most OBs and midwives. Still, because the research isn't settled, it's a good idea to limit your caffeine consumption as much as possible during pregnancy, and to stay within the recommended 200 mg a day limit. Caffeine is also present in many sodas, energy drinks, and chocolates, so be extra mindful of them as well. Effects of caffeine during pregnancy. When you drink a cup of coffee, caffeine crosses the placenta into the amniotic fluid and your baby's bloodstream. While your body goes to work metabolizing and getting rid of the caffeine, your baby's body is still developing and takes a much longer time to process the caffeine. As a result, your baby is exposed to the effects of caffeine for much longer than you are. Caffeine can also exacerbate pregnancy issues like heartburn and frequent urination, and raise your heart rate and blood pressure. The effects of caffeine may be more noticeable as your pregnancy progresses. That's because your body's ability to break down caffeine slows, so you end up with a higher level of it in your bloodstream. There's one more reason to cut back on coffee and tea, whether it's caffeinated or not. These beverages contain compounds that make it harder for your body to absorb iron. This is important because many pregnant women are already low on iron. If you have coffee or tea, drink it between meals, so it'll have less of an effect on your iron absorption. Subscribe our channel for more pregnancy and parenting videos.